So many of our medical societies agree that imaging is inappropriate for low back pain. And I wanted to just highlight the three that do. As you can see here, American College of Physicians, American College of Emergency Physicians, as well as the American Academy of Family Physicians. Next slide. And so when we're looking at those three different medical societies, you can see the differences, but yet getting to the same goal of really what not to do, and to take a look at the evidence with the American College of Physicians looking at don't obtain imaging studies in patients with non-specific low back pain. American College of Emergency Physicians take the stance of avoid lumbar spine imaging for adults with non-traumatic back pain unless the patient has severe progressive neurological deficits or serious underlying conditions. And where we have most experience of working with is with the American Academy of Family Physicians recommendation of don't do imaging for low back pain within the first 6 weeks unless red flags are present. So there are, on the other side, which I really appreciate the growth of Choosing Wisely and the incorporation of the importance of having patient-friendly materials. Because as you look at the clinician lists and recommendations, that would be extremely hard for us as consumers, patients, to truly understand what we're trying to get at here. And so looking at the patient information, it's really to help them become much more engaged in their care, to have a better understanding of the medical society recommendations, when they should consider alternative treatments, and being able to read this in plain language has really been very effective. So you can see here on the slide, there's a RAC card, and it's also, you can see it, it's a little wallet card, but we like to make the print bigger here in Maine to help everybody out, is really the cornerstone of our work has been on the 5 questions. Do I really need this test or procedure? What are the risks and side effects? Are there simpler, safer options? What happens if I don't do anything? And of course, how much does it cost? And there's also the 2-pager of imaging tests for lower back pain. It's really been extremely helpful for the patient-facing materials to get in the hands of consumers, whether it's out in the general public or whether it's used in the clinical setting, and to help people in general, consumers, patients, really understand why imaging is not the first course of action in many instances. And so you can see here a little bit better display of the 2-pager. The blue box, which I think has been very helpful in our work over the last 5 years, is to really understand what some of the alternatives are for you if you have back pain. It's always nice to know these things, and this is on the app as well. So all this information is available at our fingertips. The transparency of information has just been tremendous. So I highly recommend, if you haven't looked at all the different patient-facing materials, to figure out how you could use those in the clinical setting and how to move those forward. I know that also Dr. Barbanel will be talking about how they utilize the patient-facing materials as well as their clinical recommendations in the work that you'll hear later on in our webinar today. Thank you.